Hello, this is a video consent for laparoscopic appendectomy presented by CHI Health. By now you will have already talked with your doctor about a medical problem involving your appendix. In this video, we will walk you through the consent process for a laparoscopic appendectomy. We will discuss the planned surgery, as well as its risks, benefits, alternatives, and expected outcomes. The appendix is a small outpouching at the beginning of your large intestine, near where your small intestine empties into your colon. Appendectomy means removal of the appendix. The most common reason your doctor might recommend appendectomy is appendicitis, which is inflammation or infection of the appendix. In adults, appendicitis is most commonly caused by a fecalith, which is a hard ball of stool that plugs the opening of the appendix, leading to inflammation and infection. Though appendicitis is an infection, it cannot be passed from one person to another. Rarely, appendicitis may be caused by a tumor of the appendix. Every appendix we remove is sent to pathology to rule out cancer. If left untreated, appendicitis can lead to perforation or abscess formation. Your surgery will be done in an operating room while you are completely asleep. The length of the procedure can vary, but is usually 1 to 2 hours. It is usually done through 3 or more small incisions with the help of a long camera. We call this laparoscopic surgery. Once we have entered your abdomen, the appendix is located. A small window is made in the mesoappendix, which is a fatty web that carries the blood supply to the appendix. A stapler is then inserted into this window and used to divide the appendix at its base, where it meets the colon. The blood vessels that feed the appendix are also divided with a stapler. The appendix is placed in a bag and removed through the largest incision. Your incisions are then closed and the procedure is complete. Rarely, a larger incision may be necessary if the procedure cannot be completed safely through the smaller incisions. In addition to your surgeon, an anesthesia provider, a surgical resident or surgical assistant, nurses, and surgical technicians will be present in the operating room. Since this is a teaching hospital, medical students and other learners may also be present. Laparoscopic appendectomy is one of the most common surgeries we do, but like all surgical procedures, there are potential risks. You must be aware of these potential risks in order to make an informed decision about whether or not to proceed with surgery. Not every possible risk can be addressed here, but we will discuss some of the most relevant ones. Significant bleeding, though rare, may require hospitalization, blood transfusion, or in some cases return to the operating room. Infection is a risk which can occur in the abdomen, in the surgical incisions, or in other parts of the body. We will give you a dose of IV antibiotics right before surgery to help decrease this risk, but even with an uncomplicated appendectomy, infection may still occur. It is not uncommon for us to get into the abdomen and find that the appendix has already formed an abscess or is already perforated, causing infection and inflammation of surrounding structures. We will often still attempt to remove the appendix if we think it can be done safely. In some cases, an appendix may perforate in the process of us removing it. If there is any concern for infection beyond the appendix, we may wash out the abdomen, leave a drain, or keep you on antibiotics for a short time following surgery. Any infection or inflammation in the abdomen increases the risk of developing an abscess after surgery. An abscess is a walled-off infection that typically forms about a week after your surgery with symptoms very similar to your initial appendicitis. Treatment may include more antibiotics, drain placement by interventional radiology, or another surgery. CT scan tends to be a very good test for detecting appendicitis, but in rare cases we may enter the abdomen only to find a normal-appearing appendix. If this is the case, we will most often remove the appendix anyway, so that appendicitis can be ruled out during any further workup for the cause of your abdominal pain. Other risks of laparoscopic appendectomy include hernia formation at the incision sites, injury to the bowel or other surrounding structures, blood clot formation in the legs which can travel to your lungs, or very rarely death. Appendectomy requires the use of general anesthesia, which is the process of putting you to sleep for surgery. Your anesthesia provider will meet with you before your surgery to discuss the risks involved with general anesthesia. The main benefits of this operation include curing your appendicitis, thus preventing it from progressing to an even worse infection, and improving your symptoms. Non-surgical management of appendicitis with antibiotics is controversial and is generally not recommended in the United States for patients who are fit for surgery. This is due to the relatively high rate of recurrent appendicitis, the longer recovery course, and the very small but real risk of appendiceal cancer. After the operation is completed, you will awaken from anesthesia and be moved to the recovery room where staff members will monitor you closely for a few hours. It is common for patients to stay in the hospital for 1 or more nights following surgery. You can expect to have some pain from the incisions, which will be treated with pain medication prescribed by your doctor. Nausea medications may also be provided if needed. An ileus is a motility problem with your intestines which can cause delayed return of bowel function following surgery. This can lead to nausea, vomiting, and could lengthen your hospital stay. Before you leave the hospital, detailed instructions will be provided, including information on lifting restrictions, return to work, wound care, and planned clinic follow-up with your surgeon. We hope you have found this video to be informative. Please let your doctor know if you have any questions or concerns before proceeding with surgery.